The 2024 to 2025 flu season has been one for the record books. It's officially the most severe flu season in 15 years. This season even surpasses the peak of the 2009 to 2010 swine flu pandemic. The pervasiveness of this year's flu highlights the importance of understanding its impact and taking necessary precautions. The flu, short for influenza, is a respiratory illness caused by the influenza virus. It spreads easily from person to person, primarily through respiratory droplets released when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people nearby. Sometimes, a person might get infected by touching a surface or object that has the flu virus on it, and then touching their own mouth, nose, or possibly their eyes. While the flu can affect anyone, some groups are more vulnerable to serious complications. These include young children, older adults, pregnant women, and people with certain chronic health conditions like asthma, heart disease, or diabetes. Understanding your risk factors is an essential part of flu prevention. The severity of this flu season underscores the importance of public health measures and individual responsibility. By staying informed about the flu, taking preventive measures, and seeking prompt medical care when needed, we can all contribute to a healthier flu season. The Centers for Disease Control and Prevention, or CDC, carefully tracks flu activity throughout the United States. Their data paint a stark picture of this year's flu season. As of January 18, 2025, ILANet data showed that 5.7% of patient visits were for influenza-like illness, or ILI. This percentage is significantly above the national baseline of 3% and marks the 8th consecutive week above this threshold. The CDC estimates that, as of January 26, 2025, there have been at least 16 million flu illnesses, 190,000 hospitalizations, and 8,300 deaths from the flu. This includes a tragic 31 pediatric deaths. These numbers are constantly updated as more information becomes available, but they underscore the serious health impact of this flu season. While the flu can be miserable for anyone who gets it, it can be particularly dangerous for young children. Their immune systems are still developing, making them more susceptible to serious complications from the flu. The CDC closely monitors pediatric deaths related to the flu as a key indicator of the severity of the season. The CDC plays a vital role in tracking and responding to public health threats like the flu. Their surveillance systems and data analysis help inform public health recommendations and guide interventions to mitigate the impact of the flu season. This flu season has been particularly widespread, impacting every corner of the United States. However, some regions have been hit harder than others. The South, Southwest, and West have experienced particularly high levels of flu activity. In fact, 43 states have reported high or very high flu activity, indicating the widespread nature of this year's outbreak. The impact of this flu season has been felt not just in doctors' offices and hospitals, but also in schools and communities. Schools in several states, including Texas, have been forced to close due to high absenteeism rates among students and staff sick with the flu. For example, the Godley Independent School District in Texas closed for 3 days due to a high number of flu and strep throat cases. Hospitals have also felt the strain of this flu season, with many experiencing overcrowding and resource shortages. Some hospitals have implemented surge measures, such as setting up temporary tents to accommodate the influx of flu patients. This strain on the healthcare system highlights the importance of flu prevention and the need for adequate resources to manage outbreaks. The widespread impact of this flu season on schools, hospitals, and communities underscores the importance of community-wide efforts to prevent the spread of the flu. From practicing good hygiene to getting vaccinated, everyone has a role to play in protecting themselves and others from the flu. Staying informed about these illnesses and their symptoms can help you take appropriate precautions. Public health officials continue to emphasize the importance of vaccination, good hygiene, and seeking prompt medical care when needed. By working together and following these recommendations, we can mitigate the impact of this severe flu season and protect the health of our communities.